Welcome to the Get Fit Guys quick and dirty tips to slim down and shape up. My name is Ben Greenfield and I'm the Get Fit Guy. In today's episode, we're going to be talking about heart palpitations and whether heart palpitations during exercise are normal. Now, this topic may seem somewhat familiar because in last week's episode number 231, you learned about whether exercise can actually make you live longer and how much exercise is enough for optimal longevity benefits. Well, in today's episode, like I mentioned, we're going to look at another critical component of exercise, especially related to longevity, your heart, and specifically whether you need to be concerned about heart palpitations during exercise. A new study has actually found that many athletes have electrical heart issues, but these issues may not actually be meaningful from a cardiac risk standpoint. The study looked at the criteria for interpretation of electrocardiograms, also known as ECGs, of people's hearts, and noted that an increasing number of sporting bodies report unacceptably high levels of false positive ECGs in pre-participation cardiac screening. This means that athletes and fitness enthusiasts who have electrical abnormalities in their heart during exercise may be actually experiencing something that's kind of normal for an athlete and doesn't necessarily reflect a serious cardiac pathology, including a PVC. And while a PVC may sound like something out of a science fiction novel or a do-it-yourself household plumbing guide, it actually stands for premature ventricular contraction. And here's how it works. Every time your heart squeezes blood out to the rest of your body, it requires an electrical impulse. In a normal electrical conduction, impulses originate from an area in the top right corner of your heart known as the sinus node. The electricity then spreads across the upper two chambers of your heart, the atria, and is then transmitted to the lower two chambers, the ventricles, through something called the atrioventricular node. Well, during a normal heartbeat, your heart's ventricles contract blood out to your entire body after your heart's atria have helped to fill those ventricles. In this way, the ventricles can pump the maximum amount of blood both to the lungs and to the rest of your body. So how can the electrical misfiring in a PVC happen? Well, every piece of tissue in your heart is electrically active, and this means that all heart tissue can conduct electricity. However, all heart tissue can not only conduct electricity, but can also generate electricity. Normally, your heart tissue is conducting electricity generated by the sinus node. However, occasionally it generates electricity on its own as well. And when this happens, a premature contraction of your heart results. When a PVC happens, your heartbeat is not initiated by your sinoatrial node, which is your body's normal heartbeat initiator, but rather by special fibers in your ventricles that are triggered by the atrioventricular node, bypassing the normal method of electrical stimulation. This means your ventricles contract first before your atria have optimally filled the ventricles with blood. And this not only means that blood circulation of oxygen and nutrients is less efficient, it also means that you can feel things like palpitations, skipped beats, extra heart contractions, irregular heart rhythms, slight chest pain sometimes, and a feeling of faintness and fatigue or shortness of breath. But here's what's important to know, and what the latest research highlights. The occasional PVC is actually common, especially for athletes exercising at high intensities, and it doesn't necessarily mean that you're going to drop dead of a heart attack. Now, as a matter of fact, nearly everybody has a skipped or extra heartbeat every now and then. Cardiac electrophysiologist and cyclist Dr. John Mandrola wrote a blog post on PVCs that I'll link to in the show notes for this episode. Just go to quickanddirtytips.com and look for episode number 232. And he says that PVCs are the second most common rhythm problem he sees. He points out that a related electrical abnormality called an atrial arrhythmia, also known as a heart flutter, is the most common thing he sees. Well, in that same article, Dr. Mandrola points out a few other interesting facts, including in an overwhelming majority of people, especially those with a normal heart structure, PVCs are benign, which means that the extra beats don't actually indicate heart disease or any other serious and immediately threatening issue. The normal person has about 100,000 heartbeats per day. Elite athletes with slower heartbeats would have fewer, and only people with more than 20,000 PVCs per day are actually at risk for developing cardiomyopathy or a weak heart. That means about 20% of the time you feel a flutter or palpitation, you're likely experiencing PVCs. Now, another note that he makes is that the presence of PVCs might indicate training excess. He says, it might happen during a big training block or immediately afterwards. Of course, my theory is that PVCs associate with excess inflammation. The reason I see inflammation as the link is because PVCs often occur in patients who are exposed to stress. The middle-aged person going through a divorce, the doctor embroiled in a lawsuit, the minister who takes care of everyone but himself, the grad student during exams. The theme here is that PVCs tend to cluster at times of high inflammation, be it physical, mental, or emotional. Recently, a cycling friend told me his PVCs had resolved almost as soon as he stopped training for races. He still rides fast at times, but doesn't train. I'm not advocating not racing, it's just an anecdote. And then he also mentions PVCs could potentially be aggravated by dietary deficiencies. For example, some patients report improvement from magnesium supplementation. And another physician, Dr. Mark Serkis, said the same thing when I interviewed him on my podcast episode at bengreenfieldfitness.com entitled The Shocking Information on a Compound That Pharmaceutical Companies Really Don't Want You to Know About. So, while electrolytes might matter a little less than Gatorade would have you to believe, they're certainly important for heart health and electrical conductivity in hard-charging athletes. In an era of mineral-depleted diets, excessive stress, and overexercise, I personally suspect deficiencies are a much bigger contributor to the problem than many people might think. And this is yet another reason why I actually slather my body with topical magnesium oil after I do a hard workout. So, in a nutshell, you can think of PVCs as a canary in the mine. As a matter of fact, in a helpful forum discussion on MedHelp that I'll also link to in the show notes for this episode, it's pointed out that two conditions are known to cause PVCs during exercise. One is coronary artery disease, and the other is myocarditis, or heart inflammation. And both are often aggravated by poor exercise conditions and excess adrenaline from stress or overtraining. But in the absence of these two factors, PVCs may actually be no big deal at all. So, have you experienced PVCs during exercise? What did you do? Do you have questions? Well, head over to facebook.com/getfitguy and ask your questions there or join the conversation. And please remember that all content here is strictly for informational purposes. This doesn't substitute any medical advice, and it doesn't replace any medical judgment or reasoning by your own personal health provider. So please always seek a licensed physician in your area regarding all health-related questions and issues. And until next time, I'm Ben Greenfield, the Get Fit Guy, asking you, what are you waiting for? Go get fit.